Dr. Ronald Lett. We are on the fourth exercise involved in our series on postpartum hemorrhage. Remember, we talked about the 4 T's. This T that we're discussing in this exercise is tissue. The tissue we're talking about is retained placenta. If you have a mother that's delivered and she's after over an hour still hasn't delivered her placenta, then you need to retrieve it yourself. So we will look at this and look at the issues of bimanual removal of the placenta. If she has had her entire placenta come out, but there's still a concern about retained tissue with bleeding and fever, this would usually present a few days after delivery, she probably needs a curettage, and that should be done by a health professional with specific expertise. Curettage is quite dangerous in the postpartum situation, and so that patient needs referral. But we're going to proceed and look at the management of retained placenta. We have a patient represented by this model who delivered 1 hour ago her baby, but the placenta still has not arrived. So it's important that that placenta be delivered with a bimanual removal. So you see the patient here, she's draped, her cord is at her introitus, so we follow the cord up into the uterus with one hand. I can feel the placenta. I put my hand on the other side to support it because there's one part where it's attached, and I dissect that attachment off the uterine wall. It came off with a little bit of difficulty. I grasp the entire placenta now, and I try and deliver it. So now we have the entire placenta. I look, it looks complete. So that's a good situation. We give her uterotonics to contract the uterus, and we expect that her bleeding will now stop. We will observe her for continued bleeding. A little bit is not surprising, a lot is concerning, and we check for fever because it's also a sign of retained tissue. Okay, I would just like to summarize our series on postpartum hemorrhage. We emphasized the traditional 4 T's. Number 1, T for tone. How do you address that? You must have venous access, and we looked at that in our first series. In addition to the addition of fluid, when you have lack of tone, you need to add uterotonics like oxytocin. Secondly, tears are a possibility. We looked at perineal tears and how to repair a second-degree laceration. We also looked at a tear of the cervix and how to find that tear and close it. Tissue is another issue. The retention of placenta. We did a bimanual removal of a placenta, and we emphasized that if there is ongoing blood loss and fever, that curettage would be necessary, and this would require referral. Finally, there can be medical bleeding due to the loss of clotting factors due to severe hemorrhage. This is T for thrombin. The only alternative you'll have at the health center for this would be blood, but referral would also be an important option. So, as a midwife, you are able to address postpartum hemorrhage through tone, tears, tissue, and thrombin.
Thank you for watching, and please follow us on Facebook, Twitter, Instagram, and be sure to subscribe and like us on YouTube. If you would like more information about CNIS or on how to become our member, please go to www.cnis.ca.